Is male sterilization really less invasive than female sterilization? When thinking about permanent birth control options, many wonder if male sterilization is easier or safer than female sterilization. Both methods are effective, but they differ quite a bit in how invasive they are, how long recovery takes, and how much they cost. Let's explore these differences carefully. Male sterilization, called a vasectomy, is usually done in a doctor's office. It uses local anesthesia, so the patient stays awake but feels no pain in the area. The doctor makes a small cut or puncture in the scrotum to access the vas deferens, the tubes that carry sperm. These tubes are then cut, sealed, or blocked to stop sperm from reaching the semen. The whole procedure takes about 10 to 15 minutes. Because it's a minor procedure, recovery is quick. Most men need only a few days of rest, and side effects like swelling or bruising are usually mild. Risks are low, and the procedure is less costly compared to female sterilization. It is also highly effective, but it takes time for sperm to clear from the semen, so alternative contraception should be used for a few months afterward. Female sterilization, often called tubal ligation, is more involved. It usually requires general anesthesia and is performed in a hospital or surgical center. The surgeon makes a larger incision or uses keyhole surgery to access the fallopian tubes. The tubes are then cut, tied, or removed to prevent eggs from reaching the uterus. Because it's a more complex surgery, recovery takes longer, often several days to a week. There is a higher chance of complications like infection, bleeding, or reactions to anesthesia. The cost is also higher, sometimes several times more than a vasectomy. Like vasectomy, tubal ligation is very effective, but it is considered a permanent method. When comparing the two, vasectomy is clearly less invasive. It involves a small cut or puncture, minimal anesthesia, and a quick recovery. Tubal ligation requires a larger surgical procedure, longer healing time, and carries more risks. Cost-wise, vasectomy is generally cheaper. Both methods are highly effective for permanent contraception, but the choice depends on individual health preferences and discussions with healthcare providers. It's important to remember that each person's medical situation is unique, and consulting a doctor can help determine the best option.